I'm here as a dentist. It's kind of unusual for a dentist to actually oppose water fluoridation. The problem is it's basically mass medication without informed consent. And the problem also is kind of a one-size-fits-all solution. There's a concept amongst toxicologists and regulators called the margin of safety. And when there's a concern about a particular chemical or substance and its possible harmful effects, and the experts and regulators are trying to decide on what level might be an acceptable exposure over time, there's assigned some kind of an uncertainty factor, most commonly used is 10. And in a lot of the recently published research funded by NIH, over the last 8-10 years, and even the National Toxicology Program, who released their report after 8 years of production just last year, there is a sense that, if there's 1.5 parts per million of fluoride in the water, that is like a significant level that raises concern. Now, there's some studies showing even lesser amounts, like what we fluoridate with here throughout our country, of 0.7 parts per million. And some people would think, that's only half as much, nothing to worry about. Well, what they're missing are the principles of toxicology and epidemiology in which the uncertainty factor needs to be applied to that. So if that uncertainty factor of 10 is applied to this 1.5 parts per million that is of such concern, that drops your level down to 0.15 parts per million. So if I can leave you with something to really think about relative to the concern of this exposure of fluoride in the water to our population, that it's this uncertainty factor and this margin of safety that has not been applied to what we're doing. And that is a significant concern because you have women who are pregnant, you have infants, young children, and in those developing brains, fluoride is known to be a neurotoxin. And when that brain is developing, that's the last situation under which you want exposures of a known neurotoxin. And this raised the question, when there's all this uncertainty about what studies to believe in, applying what's called the precautionary principle, which is utilized throughout Europe tremendously, not so much in the United States, but still the concept applies. When there's this uncertainty about the data or about conclusions, it's a very wise choice to play it safe, apply the precautionary principle. And that's what I ask you to consider when you hear the dental profession espousing the use of this to reduce tooth decay. And there's a known topical effect, and we get that from toothpaste. And we've seen that countries around the world have had a reduction in tooth decay since, for decades, starting back in the 50s, probably more like in the 1970s, 50 years ago, in which the use of topical fluoride in the toothpaste is what resulted in great reduction in tooth decay.